Good morning, everyone. Thank you so much for joining us today.
Good morning.
We are going to go ahead and get started just in a couple moments. I see a lot of people are trickling in, and this training in particular has sparked a lot of interest across the community, so we want to make sure everyone's able to join in and hear from our presenters. So today we are here for a two-part training, and it's part one of our Navigating Mainstream Benefits training, specifically on SSI and SSDI. And my name is Nicole Thomas, for anyone who has yet to meet me. I'm a policy analyst at Home Base, and we're a technical assistance provider that works really closely with COCs across the Bay Area and nationally. In Santa Clara County in particular, we work very closely with the Office of Supportive Housing. And one thing that we do is organize a suite of annual trainings, the Navigating Mainstream Benefits one being one of our most popular trainings. And so we're really happy that we were able to get the Law Foundation to help us present this year. And I will be handing it over to our presenters shortly. I just want to quickly talk through some logistics before handing it over, because I know we have a lot of content to cover today. So first off, I do want to note that we are recording. We're recording so that, as always, all of our training material, that is the slide deck, any materials that are shared out, and the recording are always posted on the COC training website. So this recording will be on the website. And we'll cut out any of if there are like discussion questions at the end that are a little more sensitive, we'll cut those out. But the recording will be available. Because there's so many people, we are going to ask that everyone stays on mute for the majority of the training while our presenters are covering material. That being said, we want this to be participatory, so please do ask your questions and engage through the chat. We're going to be monitoring the chat, so please do feel free to ask your questions there. And if you're having tech issues specifically, please feel free to message me directly, and I can help. Oh no, sorry, just one second. My screen configuration is a mess. Okay. So please feel free to message me directly, and we can talk through and troubleshoot any tech issues you're having. And the final thing is I'm going to be enabling closed captions. So those should be available to you as well now. So you'll have closed captions as well. So as I go ahead and hand it over to Rachel and Becky, thank you so much for collaborating with us on this training. I'm going to ask that you all just introduce yourselves in the chat while Rachel and Becky introduce themselves. Thank you.
Hi, I'll start. My name is Rachel Mignot. I'm a senior attorney with the health program at the Law Foundation of Silicon Valley, and I will be presenting to you today on navigating mainstream benefits and talking specifically about SSDI and SSI.
Hi, my name is Becky Moskowitz. I'm a supervising attorney at the Law Foundation of Silicon Valley, and I'm mostly here to monitor the chat and assist.
So I think with that, we can get started. I know Nicole mentioned briefly that we'll be monitoring the chat for questions, and then there will be a couple of breaks throughout the presentation where we have a slide that specifically says question time. And at that point, Becky can read questions that you've put into the chat, and also we can invite you at that time to unmute yourselves to ask questions orally as well. So with that, we're going to go ahead and get started. As we've mentioned, today's presentation is about navigating mainstream benefits. I want to talk to you just first about the Law Foundation of Silicon Valley, where Becky and I both work. Our organization, which is located in downtown San Jose, is the Law Foundation, and we provide free legal services in 3 specific subject areas. We have our health practice, where Becky and I both work. We have a housing unit, and we also have a unit that focuses on legal services for children and youth. And because Becky and I live in our health unit, I wanted to let you know just a little bit more about what our specific group does. So in our health unit, our practice focuses on providing legal services to individuals in the Santa Clara County who are living either with a mental health disability or who are living with HIV or AIDS. And we assist clients in a variety of practice areas if they qualify for our services. Eminent among those services is our mental health patients' rights work, where we assist clients who are either on psychiatric holds at inpatient facilities in the county and who are entitled to hearings prior to being detained longer. We also do a lot of work around making sure mental health consumers have access to quality care and respect and dignity in the mental health services they receive. And we also do quite a bit of work around public benefits, which is going to be the focus of today's presentation. Our health unit assists clients who are applying for different public benefits, including Social Security benefits, benefits through the county like Medi-Cal, healthcare coverage, general assistance benefits, CalFresh, and a variety of other benefits that are funded either by the county, the state, or the federal government. And as we've mentioned, today's focus is going to be on the benefits related to Social Security, benefits provided by Social Security. And we also assist clients who are already on those benefits. They have post-eligibility issues, meaning issues related to their eligibility and continued receipt of benefits once those benefits have been approved. We also do a host of other work that we won't highlight in depth today, but we do want to just give you a general sense of the work that we do within our health unit at the Law Foundation. Next slide. So now that you know a little bit more about who we are, the Law Foundation, I wanted to give you a roadmap for today's presentation. As Nicole mentioned, today is day one of 2 trainings related to navigating mainstream benefits. And today's presentation is going to focus on a couple of different things. We're going to talk at first about the basic eligibility for Social Security benefits. So what is required to prove eligibility for the SSDI program as well as the SSI program, how those 2 programs differ from one another, how a client who is interested in applying for and receiving benefits can establish their disability for purposes of receiving benefits, and then what are some certain issues related to immigrant eligibility for both of those programs. After we've talked about basic eligibility, we'll talk about the application and appeal process. So I know a lot of people end up having questions about how to apply, what's the best way to get started, what information do we need to give to Social Security. And then there's also a lot of questions about, well, what happens if somebody applies for either or both of these benefit programs and they're denied? How do we appeal? How do we challenge that decision by Social Security? So we're going to talk about applying, the steps that are related to that, appealing when you're denied, and focusing a little bit on deadlines too, so people understand when certain forms or appeals are due to Social Security in order for somebody to continue pursuing their benefits. And then we'll wrap up today's presentation talking a little bit about continuing disability reviews, which is a process Social Security engages in once somebody is on benefits for a period of time, and Social Security needs to review them to see if they continue to be eligible for those benefits. So with that kind of guidance or that roadmap in place, we'll switch to the next slide and start going. We just wanted to let you know, I think we've iterated this in trainings in the past, but Social Security has a lot of complex rules, not just for lay people, but also for Social Security lawyers. The rules are confusing, they're difficult, they're complex. We often research things all the time, even though we practice this area of law. And so for people who don't even practice this area of law, it can be even more intimidating and confusing. So we just wanted to stress that you don't have to memorize everything we are saying today. I know Nicole has provided the slide deck to participants so that you can refer to this in the future. But rather than memorizing the information that we're laying out for you today, today's presentation is really intended to help you get a feel for the lay of Social Security law and Social Security benefits and the application and eligibility process, so that when you're working with clients in the community, you may be able to start issue spotting things that come up when somebody's applying or somebody's received benefits and have issues with Social Security, so that you can say to yourself, this sounds a little familiar. Let me look at the slide deck. Or maybe this is an issue where this client needs a little bit of extra help. Maybe I should refer them to the Law Foundation's health program for some counsel and advice. The bottom line is, if your client gets a letter from Social Security or has an issue with Social Security, we are here to help. So you can issue spot and certainly refer clients to us if you feel that that is appropriate. And I know lots of people have concerns and complaints about how difficult it is to communicate with Social Security. We hear that, we feel that. We can't fix it, although we do have lots of workarounds trying to get in touch with Social Security via different routes and methods. So if you're having issues with that, that's also something you can certainly reach out to us about or have a client reach out to us for. Okay, next slide. So let's talk about the basic eligibility for Social Security benefits. This is kind of step one, getting started on the application. Next slide. So as we highlighted in the training roadmap, there are two types of Social Security benefit programs, two types of disability benefit programs that Social Security, or two main types, I should say, we're going to focus on today, and that's SSDI and SSI. So SSDI, which is also known as Social Security Disability Insurance, but is also oftentimes referred to as Title II, is one of the two programs. And the other program is SSI, Supplemental Security Income, which you may often hear referred to as Title 16 as well. Both of these two programs have the same, require the same finding of disability for a person to be entitled to either of them. And we're going to talk about what that definition of disability is in a few slides. But I think the first thing to remember is the two programs have one important similarity. They both require the same finding of disability. And Social Security and the agencies that they contract are the ones who are doing that evaluation to determine if the individual has a disability that meets Social Security's definition. But the programs also differ in a large way. SSDI is like an insurance program. SSDI requires that a person has had a sufficient amount of work history to be insured. And we're going to talk about how that work history is built up in just a second. But as opposed to that, SSI does not require work history. Instead of being an insurance type program, it's really a welfare program, or basically a safety net program for clients who are too disabled to work, but they don't have work history that entitles them to SSDI benefits. Rather, they have very low income and very few assets, and they're too disabled to work. So they're entitled to and need some safety net benefits in order to help them survive. So again, very important that they have required the same finding of disability, but then the two programs differ. And we're going to talk about the importance of the insurance-based aspect of SSDI benefits on this slide. So as I mentioned on the previous slide, SSDI requires the finding of disability and also requires that a person be insured under SSDI. And the way that a person is insured through the SSDI program is by making payroll contributions through their payroll taxes. You'll see it sometimes on your pay stub or your W-2 that a person has contributed a certain amount to FICA, which is the Federal Insurance Contributions Act. That's what FICA stands for. And so if a person has paid into FICA through their payroll taxes, they may be entitled to cash benefits if they're disabled or blind, and as a result of their disability can no longer work. And the monthly benefit amounts that a person is entitled to if they become too disabled to work really depends on how much they've contributed through their payroll taxes. There is a cap, right? So even for very high earners who've paid in quite a bit through FICA taxes, the amount that they're going to get through SSDI benefits if they become too disabled to work is capped at $3,345 for this year. That amount adjusts annually, so it'll be different in 2023. But I think what we see in the work that we do is that a lot of the clients that we're working who maybe haven't been high wage earners or have worked some but haven't paid in a ton into the FICA through the FICA payroll taxes, is that a lot of the clients that we're serving tend to receive SSDI benefits in the kind of average between $1,200 and $1,500 a month. That's a more average, just anecdotally, that's a more average amount of SSDI benefits, certainly for the client population that we work with. So $3,345 is really, as a high, it's the maximum amount, but we see people receiving closer to $1,200, $1,300 a month. What's also important to remember is that, some people may only be entitled to an earned monthly benefit of SSDI, which is actually less than the SSI amount, which we'll be talking about momentarily. So for example, you may have somebody who has some work history, but they're not a high wage earner, or they haven't paid in quite a bit through FICA taxes, and maybe they're only entitled to $700 a month in SSDI. because their work history is limited or their wages were not high wages. And if that's the case, that person may be entitled actually to an additional amount of money through the SSI program. So you may see clients who receive both SSDI and SSI, and that's because the beneficiary or the client who's applying is entitled to less SSDI than the SSI amount. And so SSI may be able to make up the difference. So again, the maximum rate for an individual right now who's housed and has cooking facilities is $1,040.21 in SSI benefits. So for an individual who only gets $700 in SSDI, they may actually be entitled to a couple hundred extra dollars through the SSI program because their SSDI benefits are less than the full SSI amount. So that's why sometimes you may see people coming in and saying, well, I get SSDI and SSI. Just to kind of point that out for you because that does come up from time to time. SSDI eligibility also depends on how many quarters of earnings a client has over their working lifetime. And then equally important to remember is that after 24 months of SSDI eligibility, the SSDI beneficiary, the individual who is on SSDI, will automatically start receiving Medicare benefits. But again, that does not kick in until after 24 months of eligibility. Sometimes you'll see that it takes somebody 2 years or even longer to get onto SSDI. And when their SSDI is finally approved, it's retroactive to when they first applied. So their Medicare actually may start right when their SSDI starts, but that's only because they've been waiting 24 months for that SSDI to begin. And they're getting basically credit for the 24 months that they've waited for their SSDI to start because it took them 24 or more months to actually get onto SSDI from the initial date of their application. All right, next slide. So let's talk about, and again, this is circling back really quickly to the idea that SSDI and SSI both require the same finding of disability. But on that slide, a few slides ago, I mentioned that there's two big differences. One was that Social Security disability insurance is an insurance program, and we highlighted that on the previous slide. Whereas supplemental security income, SSI or Title 16, is more of a safety net program. So SSI, like SSDI, also provides cash assistance to people in this instance who are either aged, which means they're 65 or older, who are blind, or who meet Social Security's definition of disability. And rather than having sufficient work history, they have limited income and they have under a certain amount of resources or assets. And the amount of benefits an individual is going to get on SSI is going to differ based on a whole variety of factors. And we'll look at a table in just a moment that kind of goes over some of those factors and how it can impact the SSI rates. But again, I think I mentioned on the previous slide that, generally an individual, a housed individual with cooking facilities is in 2022 eligible for $1,040.21 a month. But again, that amount is not set in stone. A person's eligibility for SSI can go up or down slightly based on some certain factors that we'll talk about. And then, as I've mentioned, SSI is seen as a safety net program. I think that's a good kind of catchphrase for understanding how SSI differs from SSDI. So to be financially eligible, an individual, again, has to have limited income. And what that means is that their income from other sources, like potentially wages, may not be more than the maximum SSI amount. So if an individual is working part-time and maybe makes $200 or $300 a month, they're still going to be eligible for SSI. There may be some prorating of the amount of SSI they get, but they're still going to be eligible because their monthly income from other sources, for example, the part-time DoorDash or part-time Uber driver, does not exceed the maximum SSI amount. On the other hand, if somebody's working and they're making $1,200 or $1,300 a month, that does exceed that maximum SSI amount, and so they won't be eligible for SSI because their income is greater than the SSI amount. And in addition to having a limited or a low monthly income, an individual cannot have resources in excess of $2,000. Or for a couple applying for SSI, the resource limit is $3,000. And not everything counts as a resource. We could do a whole other presentation on what is a resource and what isn't. It's sufficient to say people are allowed to have one. They could even own a home and live in the home, and that's going to be exempt. They're not going to count that as a resource. An individual can have one car. But there's a lot of other things that do count as resources, like money in a bank account, or SOC or other instances, other examples like that. And again, it could be a whole other presentation, but for the purposes of today, we just wanted to highlight that individual must have pretty limited resources to qualify for SSI after the exemptions are applied. And then unlike SSDI, SSI actually comes with automatic eligibility for Medi-Cal the moment somebody is deemed eligible for SSI. So there's no 24-month waiting period. As soon as somebody is eligible for SSI, they're eligible for Medi-Cal as well. And it's a no share of cost Medi-Cal. So there's no copays, no deductibles, I should say there's no deductibles or premium costs associated with a Medi-Cal. So yeah, so that's the good news is they're automatically enrolled in SSI linked to Medi-Cal as soon as their SSI application is approved. Next slide. So in the previous slide, I referenced the table that we would be looking at just so that you could get a sense of how the SSI benefit rate can vary depending on a host of factors. So you've heard me mention a couple of times that $1,040.21 rate. So you can just see at the top of the chart that an individual who is independent is in an independent living status, meaning living in an apartment or a home or shared family home, and paying their fair share of rent or paying their rent and has access to cooking facilities is going to get the standard rate of $1,040.21. That amount goes up slightly if a person is eligible for SSI based on a disability of blindness. The rate's slightly higher. And then the other one I really wanted to highlight is that if you skip down a couple lines to independent living status with no cooking facilities, it often refers to people who are unhoused and don't have access to any kind of a cooking facility, a working stove or a working oven or any way to prepare food or meals. They're actually going to be eligible for an increased rate of SSI at $1,147.20 because that is Social Security accounting for the fact that individuals can't cook or prepare food for themselves, so they need to buy food out more, which is more expensive, and so the rate goes up slightly. And then the other one I wanted to highlight, again, I won't walk through every single cell on this table, but SSI rate can actually go down if an individual is receiving what's known as in-kind support and maintenance, basically food or shelter or through the assistance of a third party. So if they're living with a family or a friend and they're not paying their fair share of the rent, even if they're paying a little bit of the rent or they're not paying any of the rent, then Social Security accounts for that in-kind support, that maintenance and support from a third party by reducing their SSI. And I wouldn't even say slightly, by about 1/3. So if somebody's living in an apartment and the rent is $1,000, when they're living there with one other person and they're not paying any rent or they're paying less than half, Social Security considers that basically support and maintenance from a third party, and their SSI benefits are reduced accordingly. So an individual in that situation would get $764.25, or if an individual were blind, they'd get $834.30. And one of the main takeaways from this is that people who are on SSI should make sure they're communicating with Social Security about their living situation, their access to cooking facilities, and certainly if something changes, as it often does for the clients that we work with, to notify Social Security of that immediately. Sometimes somebody will be unhoused for a period of time and getting the unhoused independent living status, no cooking facility rate, but then they become housed and they have cooking facilities. And if they're getting more SSI, then it could result in an overpayment. So we want clients to make sure that they're communicating with Social Security to let them know about their living arrangements so that they get the correct amount of SSI for their current situation. But again, also just to highlight that the rates can vary on a whole host of factors. And again, nothing you need to memorize, but just a good slide to have so that you can issue spot. And if you're concerned that your client maybe is not getting the right rate, is getting too much or not enough, that could be a reason to talk to Social Security or refer a client to us. Next slide. So we spent probably the last 8 to 10 minutes talking about the major differences between the two programs, SSDI, the insurance-based program, and SSI, the safety net-based program. But when we first introduced both SSDI and SSI, we talked about the one important factor that unites the two programs, which is that both programs require the same finding of disability for an individual to be entitled to either SSDI or SSI. And so let's talk a little bit about what Social Security's definition of disability is. Social Security defines a disability as an individual's inability to engage, to do any substantial gainful activity. And we often refer to this as SGA for short, because substantial gainful activity is really a mouthful. So is a person unable to do any SGA, meaning are they able to work and earn 1,350, more than 1,350 a month in 2022. And that SGA amount adjusts upward every year, so that, you know, next year it's going to be slightly higher. Is an individual able to earn 1,400 or more? I don't know. We'll see what next year's number is. But the idea is Social Security wants to know if an individual can engage in work that nets them or results, that earns them gross $1,350 a month or more. Or if an individual is blind, the SGA amount is slightly higher at $2,260 a month. And is that inability to do SGA due to a medically determinable, meaning medical records need to suffice to show that they have a medically determinable physical or mental impairment that has lasted or can be expected to last a continuous period of 12 months or more, or result in death? So it's important to remember that this is not a short-term medical condition. It's going to last a year or longer, or potentially be fatal. And one thing I wanted to note on this slide is that at the initial determination level and at the appeal level, if somebody's initial determination is denied, the eligibility decisions, the decision of whether or not somebody meets this definition of disability, are made by an agency known as DDS, or the State Disability Determination Services. This is an agency with whom Social Security contracts, and DDS does the work of requesting medical records to evaluate the person's disability, and may also refer clients to their contracted doctors for consultative exams, all in an effort to determine whether or not somebody is disabled under Social Security's guidelines. So Social Security does work with a state agency known as DDS to help make these determinations at the initial determination and at the appeal level. Next slide. So when Social Security or their agency DDS is making the disability determination, they go through what's known as a 5-step process. And step one, we just talked about a little bit on the slide before, which is, is the claimant engaged in substantial gainful activity? Can the claimant work and earn more than $1,350 a month? If they can, if they're working and earning more than $1,350 a month, if they are engaged in that work, they're automatically not disabled, right? If they are engaged in SGA, if they're working and making $1,400 or $1,500 or $2,000 a month, then yeah, if the answer to that question is yes, they're automatically not disabled. If you can say, no, this client is not working and engaging in substantial gainful activity, and I just want to stop and say really quickly, we're talking about gross earnings. I think on the slide before I said something about netting, but it really, truly, they're looking at gross earnings of $1,350 or more. And if they can't or are not engaged in SGA, then you can proceed to step 2, which is the second step Social Security looks at to determine if somebody is entitled to either SSDI or SSI. So then Social Security asks, does the claimant have a severe impairment? If no, if their impairment is not severe based on their medical records, then Social Security will determine that they're not disabled and the application will be denied. If Social Security says, yes, this individual does have a severe impairment, then it proceeds to step 3 of the evaluation process. And that's where Social Security asks, okay, does this claimant have an impairment, their severe impairment, does it meet or equal one of our listings? And we're going to talk about listings again a little bit more in depth in a moment, so I won't go into it really in great depth here, but they have what's known as listings, which say, here are things that we consider automatic approvals for disability. If a client meets these specific listing criteria, they're automatically disabled, process over, disability benefits awarded. And so that's why it says here, if they have an impairment that meets or equals the listing, if yes, disabled, the process stops, the client's application is approved. If no, the process doesn't end. There's actually 2 more steps that Social Security needs to work through to determine if this person is entitled to SSDI or SSI. So if they do not meet a very specific listing as outlined by Social Security, then the process moves to step 4, where Social Security will ask, can the individual who's applying for benefits return to his or her past relevant work? If they can, if Social Security determines that yes, the past relevant work exists and the client can do that type of work, then they're going to be determined not disabled. If no, the Social Security says they cannot engage in their past relevant work, they still have to ask one more question before approving or denying the application. And that is, can the individual do any type of work that exists in significant numbers in the national economy? This isn't, can they do the dream job they've always wanted? Can they do only these 4 or 5 jobs that interest them? No, the question is, can they do any work that exists in significant numbers in the economy? If yes, if there's any job out there that they can do and it exists in significant numbers, then they're not going to be determined disabled and their application will be denied. If Social Security determines, no, there's not any jobs at all that exist in significant numbers, then their application is approved and the person will win and they'll be entitled, again, either to SSDI or SSI based on the other eligibility criteria. So it's a pretty in-depth, onerous process. You can see there's not just, it's not a simple question of disabled or not disabled. Social Security goes through a very rigorous 5-step process when evaluating these applications for benefits. Next slide. So let's talk a little bit more about the listings, because if a client can meet a listing, then you can win, the client is going to win at step 3. You go through step 1, step 2, step 3, you're done, and you don't need to do that past relevant work or other work in the national economy evaluation. They'll win automatically if they can meet a listing. So what are listings? So Social Security listings provide examples, specific examples as determined by Social Security of conditions that are presumed automatically to be disabling. So DDS will take, DDS again, which is the state agency, Disability Determination Services, with whom Social Security contracts. They will take the person's medical records and look at their diagnosis, the symptoms that they're suffering or living with, clinical findings related to the person's diagnosis and treatment, and any functional limitations, meaning what can they or can't they do as a result of the disability. And they'll compare that diagnosis, that symptoms, the findings, and the functional limitations to the criteria that Social Security has established through their specific listings. And if the medical records that the client has from all of the treatment they've received related to their condition show that the claimant's conditions meets or equals the listings that Social Security has outlined, then the patient is going to be found disabled. And there's a whole host of listings. Social Security's website goes through everything in great detail. But just for today's presentation, I wanted to mention that some of the body systems, the listings are organized around different body systems. And so I won't go through all of them, but just to give you an example, Social Security has listings related to mental disorders. So they'll have specific criteria related to schizophrenia or depression or anxiety. And if a client has medical records that show that their diagnosis and symptoms and their clinical findings are in line with the criteria that Social Security has lined out for depression, anxiety, or for schizophrenia, then they'll win on if they can meet the listing for those 2 factors or for those 2 diagnoses. They also have listings related to neurological disorders. So for example, epilepsy or traumatic brain injury are 2 specific diagnoses that have listings. They have listings related to the musculoskeletal system or musculoskeletal system disorders, like disorders of the skeletal spine or individuals who have had an amputation. They also have listings related to very specific respiratory disorders. So for a client who has asthma, there's a listing for asthma, there's a listing for cystic fibrosis, and there's listings for cardiovascular disorders. So for somebody who's living with chronic heart failure, there's specific listings related to that. And that is not the universe of all the listings that Social Security has, but it's just a sample. So you get a sense of, here are some of the different diagnoses or disorders that Social Security has specified and laid out criteria for. And if your client's medical records show that they meet those listings, then they're going to get automatically approved at step 3, and the application's done, benefits awarded. So next slide. So what happens if your client doesn't win at step 3? As you'll remember 2 slides back, there's actually a step 4 and 5. If they lose at step 3 or not lose, if they just can't prove that they meet a listing at step 3, doesn't mean that they lose their application. It's not denied. Social Security still needs to work through steps 4 and 5, which is, okay, well, the client hasn't met a very specific listing as outlined by Social Security, but Social Security still has the burden of evaluating whether that individual has the ability to work, even though they haven't met the very specifically lined out criteria highlighted by Social Security. So Social Security will evaluate an individual's residual functional capacity. So once you've taken into consideration all of the client's physical limitations or mental limitations or physical and mental limitations, how much is that person still able to do? And Social Security breaks down those limitations into the physical, which are exertional limitations. So Social Security will evaluate whether an individual's disability has an impact on how much they can. I think I've listed lift and carry here, but it's really, let's see, quickly, whether lift, carry, stand, walk, sit, hold, twist. So they want to know whether the person's physical disability impacts their ability to do any of those things. And if so, they'll classify them either as sedentary, meaning they really can't do much other than sit. Whether it's light, they might be able to lift a few pounds or carry a few pounds, or lift and move things around for, part of the day, but not the entire day. Or whether their limitation is actually medium and they can lift a heavier amount of weight or carry a little bit more, or maybe they can stand a little longer or walk a little longer during the day. Or whether their limitation is heavy, meaning they might be able to lift 50 pounds or more, or they may be able to stand or walk for 6 out of 8 hours a day. So Social Security will really evaluate, again, based on the medical records, how much the person can lift or carry, walk, stand, sit, crouch, kneel, and how often they can do that, and with how much frequency during the day to determine what their exertional limitations are, because the exertional limitations will have an impact on whether or not there are jobs that exist for that person to engage in. And in addition to that, Social Security is going to evaluate whether the individual has non-exertional limitations. So these are mental limitations. This isn't about whether you can stand, walk, lift, carry. This is about whether an individual can maintain concentration. Can they sit and focus on their job for 6-7 hours with small breaks in between? Or do they lose concentration frequently? Can they persist in work? Can they keep going at an adequate and reasonable pace? Can they be given instructions, 2-step, 3-step instructions, and follow through with them, or do they need constant reminders? Can they only take 1 step, do that work, ask their supervisor for another step, do that work? So what is their ability to concentrate, persist in the job they're doing, and keep pace? If they need to process 10 widgets in an hour, can they process 10 widgets in an hour? Or does it take them 2 or 3 hours to process 10 widgets? What's the pace that they work with at the job they're doing? And then another non-exertional limitation that's really important for Social Security to evaluate is whether the person has, as a result of their mental health limitations or their mental disabilities, the ability to interact properly or appropriately with their peers on the job, with supervisors who are overseeing the work they do, or if they're public interfacing, can they interact appropriately with the general public? And so Social Security will look at these factors, again, to determine if the client can do their past relevant work, and if no, can they do any other work that exists in the national economy. And I think one thing to highlight is, some of these jobs that Social Security says, well, yeah, this job exists or this job exists, so they can do either their past relevant work or some other work that exists in the economy, and the client may say, well, that's not work I'm interested in, I don't want to do it. Unfortunately, that's not a factor in the evaluation. So Social Security is not looking at whether a person can do their dream job or really even any job that they're interested in, but rather, can the person do any job given their physical and mental limitations? Can they do any job that will earn them over $1,350 a month? If they cannot, then they're going to get approved for disability after step 4 and 5. If Social Security finds that they can do any work that's going to earn them over $1,350 a month, then their application would be denied. Next slide. So a lot of times questions come up related to the use of drug and alcohol or substance use and how that impacts an individual's application for Social Security benefits. And so I think it's really important to be upfront and say that clients don't have to be 100% clean or 100% sober to qualify for Social Security benefits. But it is a consideration. And what Social Security is really looking at is whether or not an individual's impairments still exist when the person is not using, when they're sober from alcohol or substance abuse. Are they still living with a physical health disability or the mental health disability? They must show, the client must show that the impairments that they're alleging that they have still meet the disability criteria that we just talked about through that five-step process, even with total sobriety from alcohol or from other drugs or substances. So what we look at when we evaluate clients who are applying for Social Security and have been denied and want to go to a hearing to challenge the decision, and there's evidence in their medical records of substance abuse, is, is the client's disability still evident when the client is sober, or is the disability really only coming up or evidenced in the medical records when the person is using? So sometimes we'll see medical records where the records will say, well, client came in and the client tested positive for methamphetamine, client having severe hallucinations. Okay, are there medical records in that client's file that also said they were having severe hallucinations when they were not under the influence of methamphetamine or under the influence of alcohol? Do the problems still continue when the person is sober? We also try our best to look at medical records and talk to our clients about whether we can document that they had either mental health or physical health impairments that predated or occurred before substance use started. Perhaps there was traumatic brain injury or the onset of schizoaffective disorder, and then the person started drinking, or then the person started using methamphetamine or some other drug. Or did those disabilities really start when the drug use started? And it's also helpful, as I mentioned, it's also helpful to look for organic impairments, because it's easier to prove that these predate or are not specifically related or correlated to drug and alcohol abuse. So something like a traumatic brain injury or a neurocognitive disorder or trauma or personality disorder that's not going to be triggered specifically by drug or alcohol abuse, but exists independent to the use of substances. And so this is really to say that if your client comes in and yes, they have some severe impairments, but they're also potentially using alcohol or other illicit substances, that doesn't mean that they should not try to apply for benefits and may not actually have a legitimate case for benefits, because substance abuse really doesn't mean that the application is dead in the water. It means that there may be some hardships to overcome potentially, but that the client's eligibility is still worth evaluating and pursuing. So just some tips on how to handle that if you see clients coming in with medical records, but also that you have been using. Next slide. Okay, so I think one question that comes up a lot of times is that people are concerned or wondering about whether the clients they're working with who are immigrants, are they eligible for either of these two programs? And so there are some very specific rules about immigrant eligibility for both SSDI and SSI. So immigrants to the United States, whether or not they're citizens, even if they're just lawful permanent residents and haven't received citizenship status yet, they're still eligible for SSDI if they have worked and paid into the Social Security system prior to the onset of their disability. And this goes back to the idea that SSDI is an insurance-based program. So a person's immigration status is not relevant. Really, the question is, have they paid in to the Social Security system through sufficient work prior to the onset of their disability? And then they become disabled and they have the sufficient credits and work history accrued, and they've paid into the insurance system sufficiently through their FICA taxes. And so then, yes, they're going to be eligible to apply for and receive the SSDI benefits because they paid into their insurance program. So their immigration status is not relevant. So again, if they're an immigrant, they just need to have sufficient work credits to become eligible. And for the immigrant to qualify for SSDI, again, I mentioned they don't have to be a citizen, but they do have to be lawfully present in the United States. So unfortunately, if you're undocumented or if you have a client who's undocumented, they're not going to be eligible for SSDI, even if they have sufficient work credits. So to be lawfully present, the person must have a valid Social Security number. They must have been inspected by the Department of Homeland Security, who's aware of their presence in the United States, and they may not have violated any terms of admission to the United States. But other than that, immigrants are going to qualify for SSDI benefits if they have paid into the system to the extent necessary to qualify. Next slide. Eligibility for immigrants for SSI is different. SSI is typically not available for non-citizens. So even if you have lawful permanent residency status in the US, you're a green card holder, you're usually not going to be eligible for SSI, with some very limited exceptions. I won't read through all of these very specifically are very in detail because they're very specific. There are 3 groups that Department of Homeland Security has granted SSI eligibility to. But again, because these groups are so limited, it's more important to focus on what's actually available for immigrants since they're not eligible for SSI. So if you have an immigrant who is not eligible for SSI because they're a non-citizen, but they are too disabled to work and they're low income and have limited assets, then, next slide, they're going to be eligible for a program known as Cash Assistance Program for Immigrants, or CAPI. I'll stop really quickly to say that this program is not administered by Social Security. So we're deviating just momentarily to talk about a non-Social Security program, just because it relates to the idea that immigrants, most non-citizens, are not eligible for SSI. So we want people to have a resource for those individuals, because we want them to know that individuals who do not qualify for SSI because of their immigration status, but who, as I mentioned, are still too disabled to work and low income and have limited assets, should consider applying for CAPI, the Cash Assistance Program for Immigrants. What we do tell clients or people who are working with clients in this population is that before applying for either SSI or SSI-linked Medi-Cal, or for the Cash Assistance Program from immigrants, we do tell immigrants that they may want to consult with an immigration attorney to discuss whether the receipt of these benefits may harm their immigration status. That's a question that we can also speak to as well, because we've done some work around public benefits and the idea of public benefits and immigration status. So if you have clients with questions or concerns in that arena, you can refer them to us too, but we do advise them to consult with somebody who knows this area of law to better advise them about whether receipt of these benefits could impact their eligibility for immigration adjustment in the future. But assuming that there's no concerns about their immigration status and they want to apply for a benefit and they're not eligible for SSI, individuals can apply for CAPI through their local social services agency. And so I've just linked here the online application. And you see it's the Financial Assistance for Aged, Blind, or Disabled Immigrants. Or individuals can apply for CAPI by calling into the local social services agency, or by going in person to the 1919 Center Road County Social Services Agency office. So there is an alternative program if a person is not eligible for SSI because of their immigration status. Next slide. Okay, so I'm going to launch a poll very quickly. This is my little slide to remind me that just to kind of see how comfortable people are with the material, I'm going to launch this first poll and give you guys a minute. So the question is, the Social Security Administration administers 2 types of disability programs, and both require the same finding of disability. True or false? And I see lots of people still answering, so I'll give you guys another 30 seconds. Oh, sorry. Sorry about that. I hit my shredder by accident. Okay. Okay, it looks like a large number of people have answered, so I'll go ahead and say that. So the answer is true. The Social Security Administration does administer 2 types of disability programs, the SSDI program and the SSI program. There's a third disability program. We're not talking about the disabled adult child disability benefits, but that's not the focus of today's presentation. So with respect to this question, the answer is yes, they do administer 2 types, SSDI and SSI, and they both require the same finding disability. As mentioned before, the one difference is that SSDI operates as an insurance program, whereas SSI operates as a safety net program, but they both still require the same finding of disability. And that's that 5-step process we talked about earlier on. Okay, I'll share results. Okay, stop sharing. Okay, I think that works. Okay, one more, oh, next slide. Okay, thank you. One more poll question. I'm going to launch this question right here. Actually, oh, I see. Okay, I've got to go polls and switch the question. Here we go. Poll question 2 should be launched now. What are the 2 types of disability programs administered by the Social Security Administration? SSDI and SSR, SSI and SSR, or SSDI and SSI? And this is kind of just asking you to refresh your memory about the acronyms that we used for the two types of disability programs that we've been talking about. Okay, looks like I'll give you a couple more seconds as answers trickle in. Yeah, so it looks like most people are picking SSDI and SSI, and that's correct. SSDI is the Social Security Disability Insurance. SSI is Supplemental Security Income. We threw an SSR, which is actually an acronym for the Social Security Retirement Program, which is not disability-based or disability-focused. Social Security retirement is for individuals who've worked and earned sufficient credits and paid into the program sufficiently to be entitled to retirement when they reach full retirement age. Or sometimes people take retirement early. They'll get early onset retirement, but it's not a disability program. It's a retirement program. So the correct answer is SSDI and SSI. Okay, so those are the two poll questions. I'm going to stop now and solicit questions from you. Maybe Becky, if you see questions in the chat that you think are particularly helpful to read out loud, or if anybody wants to unmute themselves, we can take a couple of minutes now to answer questions about the material presented thus far.
So I noted a few of the questions as we went. Do you want me to read them out and then we can see if we have time to take a few more?
Sure, let's do that.
So the first question is, do Social Security staff tell clients who are applying no if they qualify for both SSDI and SSI? How would they know if they could get both programs?
Yeah, so Social Security representative, that's a good question. Social Security representatives should be allowing individuals to apply for both programs. So if a person calls in and they're not sure whether they, full question popped up, and they're not sure whether they're eligible for either program or potentially both, because as I mentioned earlier, somebody may get SSDI, but their SSDI may be less than the SSI amount, so they may actually be entitled to some SSI as well. So Social Security really should be evaluating an individual's eligibility for both programs. Social Security is the one who has records of how much work a person is engaged in, and so how many quarters they have accrued, and whether they have enough work history to entitle them into SSDI. And they're also supposed to be doing the evaluation of how much income a person has and what their assets or resources are to see whether they're eligible for SSI. So I think the main takeaway from that is the Social Security should be allowing people to apply and encouraging people to apply for both, so that a proper analysis can be done to see if a person is, which program the person is eligible for. Does that answer the question? I'm not sure if that got to the heart of the question. Or if Becky, if you have something else to add, feel free.
Sorry, I didn't know who asked which question.
Okay, no, that's okay.
But folks can feel free to jump in if they have follow-ups. So the next question was, can you provide more information on how Social Security determines whether a disabled child qualifies for SSI? They're wondering specifically how age relates to eligibility. And if you don't have this information at the top of your hands, Rachel, I looked it up really quickly. If you want me to read that out.
That'd be great.
So I'm going to pop in the chat a publication that Social Security puts out on childhood disability, which provides a lot more detailed information. But very, very generally speaking, Social Security's disability standard for children for SSI is that the child meets income eligibility criteria, and then based on their parents' financial situation, and then also the child has a medically determinable physical or mental impairment or a combination of impairments, and that those impairments result in marked and severe functional limitations, and that the impairments have lasted or expected to last for at least 1 year or result in death. And so just to unpack this a little bit, when they talk about functional limitations, they're a little bit different than what Social Security's focus is for adults. For adults, the focus is really on largely on their work abilities. For children, it's more of a focus on how the child's disabilities impact kind of the things a child would typically do throughout their day, such as their schooling and their activities of daily living, and their level of ability to care for themselves independently based on what would be appropriate for their age. Next question we had was, is SSI considered retiring? Are there more parts to retiring? And I think we addressed this to some extent, so I don't know if folks have more follow-up questions, but I'm just going to flag again that I'm putting in the chat another Social Security publication that has to do with retirement that unpacks it a little bit more. Yeah. Follow-up questions on either of those things, or should I read the next one?
Yeah, maybe if we can do one more question. I just want to, I know it's 12:30 and maybe I can, the next part of the slides are not quite as dense, or so we could also save some more questions at the end too. Maybe so do one more question now, and then I'll work through the next segment of the slides, and we can work through however many questions we have at the end, the way we have time for.
So I'm going to hop to this one, which was a clarification question about CAPI, which was, can you be undocumented and get CAPI?
I don't believe so. That's, gosh, I haven't done, I can look that up really quickly. I don't believe.
You're right. You cannot.
Yeah, thank you. I had to look up to be sure. So yeah, I think you have to be a lawful permanent resident. You have to, we talked a little bit earlier about what accounts for being lawfully permitted to be in the United States. So again, that you have a valid Social Security number, the Department of Homeland Security has inspected you, and that you haven't violated any of the requirements for admission into the United States. So if you're a lawful permanent resident or a green card holder, you're going to be eligible for CAPI, but undocumented persons or individuals are not. Okay. So we'll pause, and I'm sure there's lots of other questions, but I wanted to make sure we got through the rest of the slides. And again, it's a little less of a heavy lift, the second part of the presentation, and then we'll save as much time as possible at the end for additional questions. So now that we've talked again in depth about eligibility, which again has quite a lot to unpack there, and we did our best to unpack what we could in the hour, I wanted to make sure that all of you had information about how to actually submit the application for both SSDI and SSI, and what to do if it's denied. So next slide. So the SSDI application process begins when a person first submits a claim for either SSDI or SSI. And so we recommend that individuals who want to apply for both programs call the national Social Security number listed here on the slide, and they can file their claim online. And the day that they call that number or start the claim online acts as their protective filing date. So that's the date at which they potentially basically, because they're not actually eligible for benefits that date, but that's when their application starts. So if and when they're determined eligible for either program, Social Security can determine when they start to get paid out benefits based on that protective filing date. So the sooner somebody calls and sets up that interview for an application or files their claim online, acts as a protective filing date. And then if you call the national number, what will happen is that the national number will set you up for an appointment or an interview with your local Social Security office. When the offices open up, then you can have the opportunity to go and do that application in person. They'll set up an in-person appointment for you. Currently, offices are still closed. So if somebody's applying and they call the 1-800 number, you'll be set up with a telephonic appointment with your local Social Security office. But even though your telephonic appointment or your in-person appointment with the local office may not occur for a week or two, the day you call the 1-800 number still is your protective filing date. And then once you've got that claim set up online or your interview set up with the local office, the next step will be to complete the actual application. There's different application forms for both SSI and SSDI. We don't typically help clients walk through those forms just because it's not within our bandwidth to do, and because it's also partially Social Security's job to help clients complete those applications. But the application comes next, and then Social Security asks people to fill out disability reports to talk about what their medical conditions are, where they get medical treatment, what medications are they on, what are their symptoms, what are side effects from the medications, and to really outline for Social Security what the person's disability looks like. Social Security will first make a non-medical determination. And so that's the determination of, does the person have enough credits to be eligible for SSDI? Does the person, if not, does the person have limited income and limited assets to make them eligible for SSI? Because there's no point in doing a disability evaluation, which is longer and more onerous, if the person's not going to qualify because they don't have enough work history or they have high income or excess assets. So they make that first, they make that non-medical determination that we talked about earlier on. And then if the person is going to qualify on the non-medical basis, then Social Security will send all of the medical information and the releases to secure medical information to the state agency that we referenced earlier, the Disability Determination Services. And the disability analyst will be assigned to do an evaluation of the individual's medical records. They may send, the DDS analyst may send the client to consultative exams through a contracted doctor to get some more information about the person's medical or mental health or physical health impairments. DDS will then process the claim and make a determination of whether or not that individual is disabled. Once they've made that determination, DDS will return the claimant's folder, basically all the materials that have been compiled in the decision-making process, and they'll send it back to the local Social Security office, who will send a letter to the claimant saying, disability application approved, disability application denied. Next slide. So just a couple of pointers. I won't kind of beat this slide to death, but just getting started, the 1-800 number is there again. You can file a claim online. We do tell people that if they go to an office, when the office is open back up, they're not currently open, but if they go to an office without an appointment, and they want to walk in and just apply kind of as a walk-in, that can be a very frustrating and time-consuming process. And again, it's not even possible right now because currently local offices are closed, although we do expect offices to open again, hopefully in April of this year. But we certainly encourage people to try to call ahead and set up an appointment or do it online because that's that saves a lot of time and frustration as opposed to just doing a walk-in. If you help a client apply online, print out the confirmation form because sometimes the application can get lost or Social Security can say we didn't receive it. So at the very least, you can say we did submit it. Here's proof. Here's the date it was submitted. This should be the protected filing date. You may want to consider signing on as an individual's authorized representative or AR. There's a very specific form known as the 1696 that you're allowed to fill out and have a client sign, and then you can submit that to Social Security, and then Social Security will work with you as their representative so that you can help the client navigate the application process. And this is especially important if your client is homeless and doesn't get mail as often or has trouble responding to mail because of mental health limitations. You'll get the mail too, so then you can say to the client, hey, something came from Social Security, did you get it? No? Okay, I have it, come on in, let's respond. So being the AR has a really positive added benefit of allowing you to get all communication between Social Security and the client so you can help your client navigate the application process. Next slide. So let's talk a little bit more about the application process. Again, there's a lot of forms to fill out when the application process is taking place. There's the application itself, which is different for SSDI and SSI. But then in addition to that, Social Security also wants the client to fill out quite a few different questionnaires. The first and most important one is really the disability report, which is a way for the client to detail for Social Security what their medical history is and what their current treatment looks like. This form is known as the SSA 3441BK. All the forms have long numbers that you don't have to memorize, but just putting that out there. And the disability report, just a couple of tips if you're helping a client fill this report out. If it comes from Social Security and they want this information, and they will. This is kind of an absolute for any application for benefits. They're going to have to fill out the disability report. A couple of tips that we suggest is make sure that you give accurate and thorough information about every place where the client is getting any medical or mental health treatment, and make sure you provide the correct addresses and phone numbers for the clinics where the client has got past medical treatment or current medical treatment, because DDS reaches out to those medical clinics or the hospitals to get the medical records. And if the contact information is inaccurate, DDS will not get the medical records that they need. And that may impact negatively your client's application for benefits. So try to be as thorough as possible when filling out the disability report so that all the client's medical records are accounted for and obtained by DDS. Next slide. The Social Security often sends out what's known as an adult function report, and they'll also send out sometimes to a friend or family member or close relative a third-party function report. And these reports are required or helpful for Social Security because these function reports allow the client or somebody who knows the client really well to detail the client's activities of daily living. What are they able to do on a daily basis? What does their general functioning look like? So when a client is filling out an adult function report, we always tell the clients to fill it out based on what does their worst day look like, not their best day, because they don't have a best day every day. So when they're at their worst, what does their day look like? How late do they need to sleep? How hard is it for them to wake up? How hard is it for them to prep food and take care of their basic hygiene? Do they get out for a walk, or do they stay on the couch most of the day? Do they engage in activities, or are they kind of, homebound? So don't overstate the client's ability to do things on their best day. Focus on how things are and how difficult they are on the hardest days. And that adult function report is the 3373 BK. And then Social Security may send the third-party function report to a trusted third party, again, a family or a close friend who knows the client really well and knows who their disability really well and will fill it out. The client tells Social Security who they want this person to be. It's not like the Social Security just decides, I'm going to send it to this uncle or to this parent or to this individual. Social Security gives the permission. The client gives Social Security permission to contact this third party, and the third party has to fill it out without the client's participation. And they need to talk about how does this individual's disability impact their activities of daily living. Case managers can be that trusted third party to fill out the application if the client wants. And that third party function report is the 3880 BK. And then finally, Social Security will often send the client a report known as the work history report, which is the 3369 BK. And that's a chance for the client to detail the jobs they've had over the 15 years prior to applying for SSDI or SSI. So you'll fill out information about the title of the job, the location, how much the person earned, how much the person worked, and what some of their basic job duties were at that job. They may ask you for details about, did you stand, did you walk, did you lift weights, how much did you lift, so on and so forth. So it's important to be as thorough on that work history report as well. Next slide. Part of the application process, and I referenced this earlier, are consultative exams. So as I mentioned, Department of Disability Determination Services, DDS, will often send clients to what are known as consultative exams, and they'll especially do this if a client's medical records have insufficient evidence, or there's conflicting evidence in the medical records from different providers, and DDS or the DDS analyst can't get a real sense of whether or not this person qualifies for benefits. They may send them to consultative exams. The consultative examiners to whom the client is sent are non-treating doctors. They're not the client's actual treating doctors. They're non-treating doctors with whom DDS has contracted to provide a brief one-time examination. And what we often see is that the reports that come out of these consultative exams don't really reflect the true range of a client's impairments. So sometimes they can skew negatively the person's application, and we'll have to do what we can to kind of combat or say, well, actually, here's some of the inaccuracies in the consultative exam report. This isn't really truly reflective of the client's ability to engage in work. But if they're sent to a consultative exam, they have to go, or I would say it's important for them to go. If they don't go, that can also negatively impact their application for benefits. So it's important that they go. You can try to reschedule it too if a client's unable to make a date assigned to them for a consultative exam, and the DDS analyst will work with you to help reschedule that appointment to try to get them there if they can. DDS will send a CE notice by mail, so the client should keep an eye on their mail, or again, if you're the authorized rep, you'll get a notice of the DDS exam or the CE exam sent by DDS so that you know when the client has to go and where they have to go. And as I mentioned, if they can't attend, you can help the client reschedule, or the client can reschedule by contacting the analyst assigned to their case at DDS. Next slide. Okay, so I'm going to launch another poll question really quickly. Poll question 3 is, how can a client start an application for SSDI and or SSI benefits? By calling the SSA office, the national number, filing a claim online, or visiting a local Social Security office, or all of the above. Okay, I'll give just another minute. I'll wait till I get to 100 answers. We're at 78, and then we'll answer and move on. Okay, looks like one more minute. Okay, looks like a lot of people have answered. So the correct answer is all of the above. You can call the national office, you can file the claim online, you can visit the local Social Security office in person when the office opens again. But again, with the caveat being that if you go in person without an appointment, it can be time consuming and a bit frustrating. So best to avoid that if possible and try to apply by calling ahead or filing online. Next slide. So this poll question, I'm actually going to save for 1 second. I want to get to the next slide really quickly. So we'll actually go next slide real quickly and then come back to the fourth poll question. So I just wanted to highlight for everybody the actual appeals process. We've talked about starting the initial application by calling the national line or applying online or going into the office. After that initial application is sent to DDS and evaluated and returned to the local Social Security office, the client will receive an initial decision. As you can see, the approval rate at the initial decision level is pretty low. It's only 33%. And these numbers may have changed slightly, but based on our last evaluation, and certainly they won't have changed drastically, the initial application does not have a high approval rating. After the initial decision, a client can file an appeal, or what's known as a request for reconsideration. We see a few more applications get approved at this level, but again, not very many. It's even actually fewer get approved at recon than get approved at the initial level. If a person is denied a second time after the request for reconsideration, the person has the right to ask for an administrative law judge hearing, or an ALJ hearing, as we refer to administrative law judges. And you can see that actually at this level, we have the highest rate of approval at 48%. So if people are denied an initial and recon, that doesn't mean they're not entitled to benefits. Really, we see, and especially with the help of an attorney or an advocate, we see a really high approval rate, not a really high, but certainly a much higher approval rating at the ALJ level. So I think we try to encourage clients that they think they have a legitimate basis for receiving benefits to not give up after an initial denial or a recon, but to pursue that ALJ hearing. If a person is still not successful at the ALJ hearing level, they are entitled to appeal that decision, the ALJ's decision, up to appeals counsel. This is not a hearing, it's just based on the papers. So you would send a notice to appeals counsel saying you disagree with the judge's decision and here's why, and ask the appeals counsel to review it further. There's a small number of cases at that level that either are approved, where appeals counsel says, yeah, no, actually you are entitled to benefits, here you go, or remanded, which means they say, well, we can't say you're entitled to benefits, but we do agree the judge made an error, so we're going to remand it or send it back to the ALJ level, and you're going to have another hearing. If you make it to appeals counsel and your appeals counsel case is denied, it's not remanded or it's denied entirely and they say, nope, sorry, not eligible, you can then appeal further up to the district court, which is the first level of federal court. So it goes district court, appellate court, Supreme Court. You can file an appeal to the district court and ask the district court make a different decision, either by approving your eligibility for benefits or remanding it back down for a different hearing or for a new hearing because there was an error of law by the judge. So it can be a time-consuming and burdensome process from initial decision all the way to administrative law judge hearing. That can take upwards of 2 years sometimes. If you're heading to appeals counsel or district court, that can add anywhere from 6 months to another year at each level. So you do see people waiting 2, 3, 4, sometimes even 5 years to get on benefits, especially if they have to work their case all the way up through the district court. And then let's go back one slide real quickly, just so I can throw out the poll question here. So this poll question is just related to the slide we talked about. What is the appeal level immediately following recon? Is it the appeals counsel? Is it an administrative law judge hearing? Or is it district court? And I'm going to launch now. There we go. So what comes right after you file for recon and it's denied? Okay, and because I know we're running a little short on time and I want to save time for questions at the end, I'll go ahead and, I know people are still answering, but I'll go ahead and say that the correct level after recon is the administrative law judge hearing. So again, it goes initial application, request for reconsideration. If that's denied, an ALJ hearing, then appeals counsel, and finally district court. although technically you could also go up to the appellate court and Supreme Court too if the Supreme Court accepted it for hearing. But for the purposes of today, the ALJ hearing follows a request for reconsideration. Okay, so go ahead and skip 2 slides ahead. There we go. Okay, so just to talk to you about deadlines so that you're aware, if a person's application is denied or the request for reconsideration is denied, Social Security will send a notice by mail. The deadline for either appealing or for asking for an ALJ hearing is 60 days plus 5 days for mailing. So it's really actually 65 days. And that 65 days starts based on the date on the notice. So count 65 days out. If it's January 1st, you have 65 days from January 1st. If possible, we encourage people to file an appeal online. Those have a tendency of getting less lost. And if you do file an appeal online, print out confirmation that it was filed. If a person files an appeal in person when the office is open back up, then get it date stamped and keep a copy. Or if you mail it in or fax it in, try to get either return receipt showing that it was delivered or a fax copy to confirm that the fax went through. If a client misses an appeal deadline, they miss that 65-day deadline, there are exceptions for good cause. So for if your client, for example, somebody may be homeless, and these are examples, but they're not limited to these examples. But some good cause examples are a person may be homeless, so they have difficulty receiving mail, and they may not have gotten their denial in time and don't have the ability to get in an appeal within 65 days. Or somebody may be living with some serious mental health or serious physical health issues or conditions that have prevented them from appealing timely. Or maybe there's been a death or a serious illness in the immediate family of the person applying for benefits. So they may need some extra time to apply. Those are all examples of good cause where a person would actually have some more time to file a late appeal. And if you see clients in those circumstances like that, in those circumstances or similar circumstances, you can refer them to our office so we can help them, assist them by submitting a late appeal with a good cause notice explaining why they did not meet the 65-day deadline. So keep an eye on that. I think if the 65 days goes by and they've missed it, I don't think, again, that's a reason to say, too bad, your application's dead. Keep an eye out for good cause exceptions for filing a late appeal. Next slide. Let's pause questions real quickly. I'll just walk through the continuing disability review so that we have like 10 minutes at the end for all the questions. So continuing disability review, next slide. Just so you know, if somebody is approved for SSDI or SSI after that 5-step process, Social Security tends to, although this isn't exact, tends to conduct what is known as continuing disability reviews or CDRs approximately every 3 years. It may be more frequently, especially if the disability that the person is living with is expected to improve. And this is essentially Social Security's way of saying, okay, you've been on SSDI or SSI for X period of time. Are you still entitled to these benefits? Are you still too disabled to work? And Social Security will notify the claimant by mail. They're reviewing their disability claim. They'll send them a letter saying, just so you know, we're just looking at your case. We want to make sure you're still entitled. Here's some new questionnaires to fill out. Tell us about your disability. Tell us about your activities of daily living. How have they changed, or are they the same as when you filled out your initial application? If after a CDR, Social Security says, I'm sorry, we actually don't think you're entitled to benefits anymore, we're stopping them, then the person whose benefits are being terminated has the same levels of appeal that we talked about for an initial application. They can request reconsideration. That's the first level appeal. They can ask for an ALJ hearing if it's denied an appeal. They can go to appeals council. They can go to district court. So we do see clients who come in who are on benefits and their benefits are being terminated and they need assistance appealing or going to hearing. And those same appeal rights apply. Next slide. If Social Security determines after their review that the disability is ended, it will send what's known as the Notice of Disability Cessation. You have 65 days to appeal that. But what's very important to remember is that if a person wants to appeal and wants to keep getting their benefits while the appeal is pending, the timeline is much shorter. They only have 15 days. That's 10 days plus 5 from mailing to submit the request for appeal and the request for their benefits to continue while that appeal is going forward. So if you can, do everything possible to help the client submit the appeal within the 15 days after the date on the Notice of Disability Cessation so that the client avoids a lapse in benefits. You can submit a good cause, or you can refer to our office if you think there's good cause if they miss that 15-day deadline, but there still may be a lapse in benefits before we can get that 15-day, request for continuing benefits and appeal in with good cause and explain why it's late and try to get them back on benefits. So if possible, try to get their request for appeal and request for continuing benefits in within the 15-day deadline. Otherwise, if a person's just appealing and they're not concerned about getting continued benefits while the appeal is going forward, then you still are using the same deadline for appeal, which is that 65 days that we talked about earlier when somebody's filing an application and an appeal and a request for ALJ hearing. Next slide. Okay, so I know that was a lot of information I tried to sum up in the last part just so we could have time for questions. And so I'll open it back up for questions now. And Becky, if there's slide chat questions, feel free to let me know.
All right. Should I read out some of the other ones we noted?
Sure.
Sorry, I don't think we're gonna have time to do all of these, so I'm trying to find the ones that the most people will have.
Sure. And actually, maybe Nicole, if you don't mind throwing up the slides real quickly while Becky's looking for those questions, I just wanted to go to the very last slide just so you can have our referral information. So we won't do troubleshooting application issues. We don't have time. Next slide. How to refer clients to the Law Foundation. There's a CCP referral form that exists that you can fax to us. We have a link here to our online referrals via a tiny URL. You can also email our health intake for our intake specialists to be apprised of any intakes that are coming in, or you can have clients call our intake line directly. So this is in the slides that Nicole is providing you, but just so you have it here, there's multiple ways to access our office. And when we do open up in person, we will take walk-ins, but we're not open yet to the general public.
So next question is, what is the retirement age for people to get onto SSI?
So not a retirement age, but we talked about how SSI is for individuals who are either aged, disabled, or blind. And the aged category, a person has to be 65 or older, and then also meet the income and asset requirements that we talked about as well.
And Rachel, correct me if I'm wrong about this, but folks can also opt to get early retirement at age 62, right? But they receive a reduced amount of their Social Security retirement income if they do take it early?
Yeah, that's correct. I think, yeah. And the age for early retirement or full retirement changes a little bit based on your birth year. Yes, people can opt for early retirement and take a little bit of a hit or take a slight reduction in their retirement benefits for opting for them early. But I think a lot of people who are aged 65 or older and who are eligible for SSI either have very little in retirement income or have no retirement income, which is why when they hit 65 or older, they're age eligible, and if they have limited income, either no retirement or very small amount of retirement and very limited resources or assets, then they're going to be eligible for SSI based on their age.
Next question is, what recommendations do you have for people who need significant assistance with the application process itself, particularly if the agency doesn't have case managers or will not allow the case manager to act as an authorized representative?
I think, well, I mean, the question right. So this is the case where the agency that's trying to help the client doesn't have caseworkers who can do it. I think, or the client says, no, I don't want you to be the AR. I think as much as you can still help. So if you don't actually have the capacity to help, I think I would encourage the client to try to find a family or a friend that they trust to sit down with them to help fill out the application. Encourage the person to work with Social Security, who should be helping them fill out the application as well. Even if they won't let you sign on as the AR, if you have the time, you could still help them fill out the questionnaire and help them mail it in or fax it in or submit it online. You don't have to be the authorized representative to do that. But if it's really a bandwidth or a time issue, then and you just don't have the time, I would encourage the client to try to fill out the forms to the best of his or her ability, or to seek the assistance of friends or family members to help them as well. And just encourage them, if you don't have the time to do it, remind them and encourage them to be as thorough as possible with the information that they include in the form. Do you have other thoughts, Becky, about how we could help clients get it done?
Yeah, a few suggestions. So one, while Rachel says that Social Security should be able to help folks with it, it's not their standard practice to do that. So if an individual needs that help because of a disability, what they should do is request that help as a reasonable accommodation of their disability. And Social Security does have a legal obligation to accommodate people's disabilities as needed. The other thing I generally tell folks is what you fill out on those questionnaires. Basically, the things to focus on those questionnaires that are most important is getting the contact information for each place to request their medical records from, to make sure that Social Security is actually getting their medical information. And then when it comes to discussing their day-to-day functioning, Social Security almost never makes their decision based on what the person self-reports on there. The only things I would caution against is either saying, I'm super great and everything's super easy for me, or saying, exaggerating so much that it undercuts their credibility. But beyond that, I tell folks, like, just do your best with it. There's nothing you're going to write on there that's going to like suddenly make this process smoother, as long as Social Security can get access to your medical records.
Yeah.
Do we have time for another question or two? Yeah.
Sure. Yeah. I've got time. I've got 5 minutes. That's okay. I saw somebody asked if the AR can sign the application form, and no, even if you're the authorized representative, the client still needs to sign the release forms. Not every single part of the application actually requires a client signature, but where it does, the client needs to sign rather than the authorized representative.
And another one of the questions from earlier is, can a person who has a legal Social Security number and has worked here and paid taxes but has no immigration status, are they able to apply for Social Security benefits? Or it says SDI, which is usually the acronym for state disability insurance, but I think they meant SSI.
So if this is a person who's here with a Social Security number, but it's not lawfully permitted to be here?
Yeah, and my hunch is that this is where things get a little confusing, because most likely the Social Security number that they're working under and paying taxes under is probably not one that's been assigned to them.
Yeah. And I think that, I mean, if they're working under a Social Security number that's not been assigned to them, and then they apply for SSI benefits, I think there may be concerns and questions about fraud or identity concerns and questions. So I would think that I think the general rule is that if you're not a documented individual, you can't apply for SSI. If you're non-citizen, you can't apply for SSI unless you fall into one of those 3 categories highlighted on one of the slides in the presentation. And so unless you're a citizen, then you're not going to get SSI. And if you're undocumented, you can't even apply for CAPI. But if you at least are a lawful permanent resident who's too disabled to work and has limited income and assets, then CAPI is your best option. But SSI is not going to be an option for that individual. Somebody texts Social Security is their real number. So if Social Security, if they're using their real Social Security number, then they must qualify as they must be documented. They must qualify as a lawful permanent resident at the very least. But in that instance, they're still not going to qualify for SSI, because they're non-citizen still. So I believe, I'm not an immigration specialist, Becky, maybe you're right. Do you get assigned a Social Security number when you become a lawful permanent resident? You do,
so
correct?
You do. There's also a few other immigration statuses where you might get a Social Security number. And so it sounds like this is probably a situation where the client does have some sort of authorized status in the United States, but it's not uncommon for people to not really know what it is or to have lost the paperwork. I can look up and pop into the chat the National Immigration Law Center's information about what immigration categories qualify for different benefits. And then maybe you can ask that person some follow-up questions to try to tease out what kind of status they might have.
Yeah, I do think it's really important to figure out the person's exact status, but with the caveat that most non-citizens are not going to be eligible for SSI. Maybe one more question. We're right at 12:59. I know Nicole.
I'm sorry.
Go ahead, please. Yeah.
Yes. I just wanted to ask. So I didn't hear it. I'm sorry if it was already asked. If your spouse dies and you're able to, are you able to collect under their Social Security? And if so, when?
Oh, and if so, what? Becky, I think this is not an area that I'm super familiar with. I haven't done a little work. Do you know more about collecting under deceased spouses' benefits for disability? Not retirement, but disability.
Pretty generally.
Yes.
So we tend not to see these cases because basically if you meet eligibility criteria, it should be pretty automatic. There are requirements for how long you're married before you would be eligible for the survivor's benefits. And then there's also a calculation if the individual applying for it is already getting some other form of Social Security, like disability insurance and stuff like that. They'll do a comparison to see which benefit would be more. But I'd recommend to anyone who thinks they may be eligible for that, just talking to Social Security about it directly. It's usually a much smoother process than for the disability benefits.
Yeah. I had a quick question about, I had a client that is getting SSDI, but they were working part-time and then they lost their job during COVID and they wanted to apply for unemployment. But unemployment in California says that you have to certify that you can work full-time and they can only work part-time because of disability. Could they apply for the unemployment?
Were there some changes to unemployment insurance with part-time work? I thought there was some changes that said because of COVID, if you couldn't do full-time work, they even made some allowances for part-time work. Am I remembering that correctly, Becky? Do you know?
Sorry, you sounded really muffled.
Oh, I sounded muffled. I'm sorry. So the question is, if somebody's getting SSDI, but then they lose their job, can they also apply for UI? I mean, I think, I don't remember the exact rule. I think it's fine to apply for unemployment insurance and see what the EDD says, right? Because the EDD would make the determination if they're able and available to work. And if they can only work part-time, I'd have to look up the EDD's rules about whether they're able and available to work if they can work part-time. I don't know off the top of my head.
And during COVID, if their payment for unemployment would exceed the SSDI limit because they had those extra $600 benefits, they would have to reapply after unemployment, correct? So they would lose their disability because of over income. Is that true or not?
So I think right now we're using SSI and SSDI interchangeably. And so this is sounding a little too client specific for us to really address this right here. And I'm a little worried we're going to mislead you because it sounds like we have some of the details not fully fleshed out. So my recommendation is if folks have very specific client focused questions, to have the client contact us directly or to contact us when the client's with you.
Yeah.
I have a quick question. Sorry. Go ahead.
And we do need to wrap this up because we're at 1:02 right now. But just a reminder, tomorrow's training will be recorded and that recording will be shared out with this group if you're unable to make it. And I think some of the questions that you all have that were not addressed today will get covered tomorrow. So we encourage you to join us again.
Can I ask a quick question?
Sure, let's do just one last quick question.
Okay, go back to the Social Security question that I asked. The person that I'm talking is my client, has been here since like 1978 when the Social Security card did not have unemployment or employment authorization on them, and has resided here since then from Canada. And she has worked here. Can she apply for Social Security benefit retirement?
So again, I don't think we can answer any client-specific questions in this format.
Just in general, can a person with the valid Social Security apply for Social Security benefit, retirement?
I mean,
without immigration status?
So when you apply for Social Security, one of the first things they do is go through the non-disability eligibility criteria, or, you know, there is no, I don't think there's any harm in them applying,
Okay.
as long as they're not saying anything untruthful on an application.
Yeah, they're not. And they're not applying for disability. They're 63 and applying for their Social Security retirement benefit.
And Social Security can do an analysis of whether they have sufficient work credits and how much they paid into the retirement pot to determine if they're eligible and how much they're eligible for. So I agree with Becky. There's no harm in applying as long as they're providing all accurate information on the application, and then Social Security can make the determination about whether they're entitled and to how much they're entitled.
Yeah, and then the one general piece of advice I'd caution, because we don't have a lot of immigration law expertise, is if they're considering adjusting their immigration status, they may want to talk to an immigration attorney before applying for any cash benefits.
Thank you.
But we should probably wrap. Thank you all for being like such an actively engaged group. I know it's really hard to do these trainings over Zoom, and I really appreciate the interaction.
And we look forward to seeing you tomorrow if you enjoy our presentation. Thanks, everyone.